everyone, my name is Kay and I'm here with the SHINE program. I'm going to go through a conversation on Medicare and changes for next year, and I hope by the end I have answered questions for you related to Medicare and plans, and we'll take questions along the way. So let's get started. I've given you 2 packets of information, and the first one we're going to start with is the one that says, what are the parts of Medicare? That's where we're going to start. Okay, so if you're wondering where these papers come from, these come from the Medicare and You handbook that you should have received in the mail. Now I have to confess, I actually have not received my Medicare and You for 2019. This is the Medicare and You for 2018, but I bet that you folks got it in the mail. And these sheets that we're going to go over initially come right from the Medicare and You handbook. So you're going to see that there are some handy references on here for page numbers. So if you'd like more information, this is just referring you to the pages in the Medicare and You handbook that will help to answer your questions related to the various parts of Medicare. So let's get underway. So with Medicare, there are 4 parts. There's Medicare Part A, B, C, and D. So when I talk about original Medicare, I'm talking about Medicare Parts A and B. Those are the parts that cover your medical services. When you think Medicare Part A, think inpatient services. There are several things that Medicare Part A covers, but just kind of at a general level, when we think Medicare Part A, we think inpatient. When you think Medicare Part B, think outpatient services. So let's talk a little bit more about that. Medicare Part A covers things like inpatient hospitalization and skilled nursing stays. Those are some of the services that are covered under Medicare Part A. With Medicare Part A, for most folks, there is no premium. Most people have premium-free Medicare Part A. However, if you just have original Medicare Parts A and B, there are deductibles associated with it. So with Medicare Part A, there is a deductible if you go in the hospital. This year, in 2018, the Part A deductible is $1,340. So if you go in the hospital and you just have original Medicare Parts A and B, I can tell you that you're going to have a deductible for that hospital stay of $1,340 this year. Plus, on top of that, you're going to have a coinsurance of 20%, which is going to be for your physician-related services. So folks will often ask me, if I just have original Medicare Parts A and B, what's it going to cost me if I go in the hospital? And I have to say, I don't know what your total bill is going to be. I can tell you that you're going to have a Part A deductible of $1,340 this year, but then also you're going to be paying 20% of the physician services, which is of course going to depend on what services you received while you're in the hospital. So therefore I can't tell you definitively what that amount is going to be. So I just want to make sure that folks understand with Medicare Part A, generally for most folks, it's premium free, but there is that deductible. This year it's $1,340. It's going to be going up slightly for 2019, and we're going to talk about that when we talk about 2019. So with Medicare Part B, there is a monthly premium, and the standard premium for Medicare Part B, remember, think outpatient services, the premium for Medicare Part B for most folks is $134 a month this year. For most people, if you're taking your Social Security benefits, the Part B premium comes right out of your Social Security check before it's deposited. They take that right out, so most people never see it, they never think about it. But that's the premium for most folks, is $134. For people who are lower income, you might pay less, or the state may pay that premium for you. For people with higher incomes, you may pay more. There's an income-related adjustment based upon income if you're a high-income earner. But for most people this year in 2018, the Part B premium is $134, and that will be going up slightly, and again, we'll talk about that later. With Medicare Part B, there is also a deductible. However, the Part B deductible does not act in the same way as the Part A deductible, and I'm going to explain a little bit about that. In 2018, the Part B deductible is $183. It's going up slightly to $185 next year. And the Part B deductible is an annual deductible. So that means that you pay out of your pocket until you reach the deductible if you just have original Medicare Parts A and B. And once you hit that Part B deductible, then what happens is Medicare pays 80% and the beneficiary pays 20%. So very often when you're talking with folks, just generally speaking, you'll often hear people say, well, Medicare pays 80% for everything and I pay 20%. And it's not quite that simple because of the deductibles, but you will hear that frequently, that people will say, well, it's just an 80-20 split. A little bit more complicated than that. But I do want to point out, whereas the Part B deductible is annual, you just pay the deductible once and then you go to the 80-20% split. The Part A deductible may be assessed to you multiple times during the year if you have multiple hospitalizations. So the way that that works is the Part A deductible applies if you go into the hospital and you're discharged from the hospital, you go home, and if you're out of the hospital for more than 60 days, and then you have a subsequent hospital admission, you're going to have that Part A deductible again for that second admission. However, if you are hospitalized twice in a relatively short period of time, there's not 60 days between the hospitalizations, you're just going to pay that deductible once. So I just want to make sure that folks understand, whereas the Part B deductible is only one time per year, the Part A deductible can be multiple times. Okay? So we talked a little bit about A, we talked a little bit about B, and again, if you're looking for more information about that, you can see right here, if you're looking for information about Part A, you can go to the Medicare and You 2019 and look at pages 25 through 28. And if you're looking for more information about Medicare Part B, you can go to pages 29 through 49. Okay, we're going to skip Part C. I'm going to talk about that a little bit later, and we're going to talk about Medicare Part D. When you think Medicare Part D, think D for drugs. Medicare Part D is your prescription drug coverage, and we will talk more about that. But basically, there are two ways to get your Part D coverage, either with a standalone prescription drug plan, or PDP, or if you go with a Medicare Advantage plan, where you get your medical plus your prescription under the same plan, you would get your Part D benefit from that Medicare Advantage plan. And as I said, we're going to talk more about that. So does everybody have a general idea, A, B, C, and D? Okay, those are the basics. Let's go on to the next page and talk about how you actually get those benefits. So generally speaking, there are two ways that folks can take their Medicare benefits. And this is a good time to just take a quick break and say, for those of you who have retiree group coverage, if we have anybody here who is a former town employee, city employee, state employee, if you're a municipal employee, you may have coverage from the GIC. There might be folks who this information does not apply to. If you're getting benefits from your former employer, what I'm talking about here may not apply to you, and I'd be more than happy to take specific questions at the end related to your particular circumstance. The other folks that this may not apply to, if you qualify for Medicaid, which is insurance for folks with lower income, you may have Mass Health here in Massachusetts, and the information that I'm going to provide may not fit exactly with what your circumstances are. And again, we'd be more than happy to talk about your specific circumstances later on. We are very lucky. I should have introduced Marilyn at the beginning, the Shine Counselor here in Lancaster. Marilyn will be able to answer questions, and if you'd like to make an appointment to see Marilyn, you can do so here from the Senior Center. And she's a wealth of information, and we'd be more than happy also to talk about your specific circumstances. Okay, so for everyone else, let's talk about the basic two ways that people take their Medicare benefits. We're going to start with the left-hand column. So some people will take their original Medicare Part A and B benefits from the federal government. So when I say you take them from the federal government, what I mean is the feds administer the benefits for you. They're actually paying the claims when you go for medical services. So you can get your A and B from the feds. Now what you can also do, as it says here, you can add a Medicare Part D prescription drug plan. You can go out and purchase a standalone drug plan from an insurance company that's offering Part D plans. So when the government set up Part D, it started in 2006, they said, we'll continue to administer the Part A and B benefits, but we don't want to administer the Part D benefits. So to get the prescription drug coverage, you go out to an insurance company that's offering Part D and you pick up the plan that way. So you can get original Medicare A and B medical benefits from the feds, pick up a Part D prescription plan from a standalone prescription drug plan. And then at the bottom of this column, you can see that some people also choose to take a Medicare supplement, also known as a Medigap plan. And Medicare supplement or Medigap plans help to pay for what you would traditionally be responsible for. So with a Medigap plan, if you're talking to friends and family who live outside of Massachusetts, they're going to try to confuse you. In other states, there are lots of options. There are up to 10 options that you can choose from. Here in Massachusetts, we basically have two types of Medicare supplement plans to choose from. There's the core plan and the supplement 1 plan. So the way that these plans work is you buy a Medigap or a Medicare supplement plan from an insurance company, and as I said, it helps to pay for your medical benefits that you get from Medicare Part A and Part B. And the two types of plans that they offer are called the core plan and the supplement 1 plan. The way that the core plan works is with a core plan, you go and you have services, Medicare pays what it's responsible for. You would still be responsible for the Part A and the Part B deductibles, and then the core plan would pick up that 20% coinsurance that I talked about on the Medicare Part B side. So with a core plan, again, you're still responsible for the Part A and Part B deductibles, but the core plan will pick up the 20% coinsurance. The core plans next year start at about $98 per month. And the premium is in addition to the Part B premium that you pay through your Social Security check. Just so we're clear about that, it is a separate premium, just as there is a separate premium for the Part D prescription plans as well. So core plans start at about $98. The other type of Medicare supplement plan is called a Supplement 1 plan. And with the Supplement 1 plan, when you receive services, Medicare pays what it's responsible for, and then the Supplement 1 plan picks up the deductibles for Part A and Part B and the 20% coinsurance. So as long as it's a Medicare-covered service, Medicare is going to pay what it's responsible for, and then your Supplement 1 plan pays what you traditionally would be responsible for, the deductibles plus the 20% coinsurance, which means that there is not any additional money coming out of your pocket beyond the premium. Okay, so does that make sense? So going down this side, again, just to kind of recap, what some folks do is they take their Part A and B from the feds, pick up a Part D prescription plan, and add on a Medicare supplement plan to help pay for what Medicare doesn't cover. So this is one route that people will choose to do. Okay? So now let's talk about the right-hand side. This is the other option that you have to do, that you can choose from. Some folks choose to go with a Medicare Advantage plan. This is Medicare Part C. I told you we'd come back around to this. So with the Medicare Advantage plan, this is a plan that you'd pick up through an insurance company. And the Medicare Advantage plans are insurance companies that contract with the federal government to provide all of the same Part A and Part B medical services that you would get under original Medicare. And in addition to the Part A and B medical services, they also can provide your Part D prescription coverage, and there can be additional benefits that you can receive as well from a Medicare Advantage plan that you wouldn't get under original Medicare. So some folks will tell me, well, geez, I don't want to go with a Medicare Advantage plan because what if it doesn't cover what original Medicare would cover? And I like to tell people you don't need to be concerned about that. These companies contract with the federal government, and the agreement that they make is that they would provide all of the Part A and B medical services. And then in addition, if you want the Part D coverage, you get your prescription coverage right through the same plan. And then again, as I said, there can be some additional benefits as well. Medicare Advantage plans tend to have a lower monthly premium than a Medicare supplement plan. But let's talk about your cost sharing if you go with a Medicare Advantage plan. And I spoke with somebody about this a little bit before our meeting started. With Medicare Advantage plans, they work very much like the commercial insurance you may have had while you were still working. It's like the insurance that I have. When you go to receive services, there will probably be a copayment associated with that service. So for example, with a Medicare Advantage plan, you might pay $25 to see a primary care physician. You might pay $40 to see a specialist. You might pay $300 or $350 a day if you're in the hospital for the first 5 days. So with Medicare Advantage plans, you forget all about the deductibles and the 20% coinsurance that we talked about with original Medicare, and instead there are set co-payments, generally speaking, with the Medicare Advantage plans. So we have 6 companies in Massachusetts who are offering Medicare Advantage plans next year. They are Aetna, Blue Cross Blue Shield of Massachusetts, Fallon, Harvard Pilgrim, Tufts, and United Healthcare. So you've got 6 companies that you can choose from. There typically are 2 types of plans that you can get under a Medicare Advantage plan. One type is called an HMO. The other is called a PPO. With an HMO, which stands for Health Maintenance Organization, generally speaking, you must stay within the network of doctors and providers that plan contracts with. If you go outside of the network, that service may not be covered unless it's an emergency situation. So HMOs can be a great plan for some folks as long as your doctors are contracted with that plan. So what I tell people is before you look at a Medicare Advantage plan, the first thing that I want you to do is I want you to check to see if that plan contracts with your doctors, your primary care, any specialists that you have, the hospital that you would be interested in going to if you needed to be hospitalized, because an HMO is not going to be a good plan for you if they don't contract with your doctors. You would need to change doctors. So a PPO, the other type of plan, PPO stands for Preferred Provider Organization, and with the PPOs, you have a little bit more flexibility. Generally speaking, with the PPOs, you can stay in network, and it might save you a little bit of money, or you can go out of network and you'll still have coverage. It just may cost you more than if you stay in network. So even with a PPO, it's good to check to see if your doctors are contracted because, again, if you stay in network, it could save you a little bit of money. If you travel, this is one of the important things to think about with a Medicare Advantage plan. If you snowbird in particular, if you're away from home for a longer period of time, an HMO is probably not going to be a good option for you because the only coverage you will have will be emergency or urgent care needs. So if you travel, having a PPO, Medicare Advantage plan, may be a better option, or going back over to original Medicare plus a Medicare supplement plan. Because if you remember, we didn't talk about doctors' networks at all when we were talking about original Medicare, and that's because with original Medicare plus a supplement plan, you can go to any doctor who accepts Medicare. So again, if you are out of the area for a long period of time, a Medicare Advantage HMO may not be a good option for you. A Medicare Advantage PPO, where you can go out of network, might be a good option, or going with original Medicare would also be a good option so that you could be sure you could receive whatever services you needed, even if it isn't an emergency, when you're out of the area. Okay? So we're going to talk more about the premiums for the Medicare Advantage plans as we move through the presentation. But what I'll say is, as I said before, the Medicare Advantage plans tend to have a lower monthly premium than the Medicare supplement plans, although there are some exceptions, and we'll talk a little bit more about that. But just remember that with a Medicare Advantage plan, you're going to have those co-payments when you receive services. So does anybody have any questions about kind of the 2 options, the 2 routes that you can take? No? Okay. So let's continue on to the next page, and I'm not going to read through this, but again, this is a page that I copied for you from the Medicare and You Handbook. These are pages 6 and 7. This chart is a very handy reference to compare how original Medicare works versus how Medicare Advantage plans work. So we've talked about some of the things on this. For example, your choice of doctors. Again, with Original Medicare, you can go to any doctor who takes Medicare. On a Medicare Advantage plan, if you're in an HMO, you need to stay in-network. With a PPO, you can stay in-network or go out of network. So this chart provides you with that kind of information so you can see how Original Medicare works versus how Medicare Advantage plans works. And again, I'm not going to go through this whole thing. I kind of hit on some of the big ones, but it would be good to read it at your leisure so that you can understand the difference. Okay, so we've kind of gone through what I call a Medicare 101. We've got you reacquainted with how Medicare works. So now let's talk about 2019. So we're going to switch over to the other packet of information. At the top of the first page, the first slide, very important, this gives our contact information. If you want to call the Shine office, our regional office is located in Milford, and our phone number is right here on the first page. You can always feel free to give us a call during the day if you have questions. If we're unavailable, just leave a message, we'll get back to you. And again, also, Marilyn's here in Lancaster, and you can make an appointment if you want to meet with her one-on-one, and you make an appointment here through the Senior Center. They can help you out with that. So at the bottom of the page, let's talk about some important dates, okay? We are in what's called the annual enrollment period right now. Most people refer to it as open enrollment. And this period goes from October 15th through December 7th. And you can make a change to your Medicare Advantage plan or your Part D prescription drug plan between now and December 7th, and that change will take effect on January 1st. And we have this open enrollment period at the end of each year. So if you're new to Medicare and you're thinking about which way you want to go, if you want to go with Original Medicare plus a Part D plus a supplement plan, or you want to go with a Medicare Advantage plan, just keep in mind at the end of each year, you're going to have this period during the fall where you can decide, well, geez, maybe I want to do something different for next year. So you're always going to have this open enrollment period to kind of look at where you are and decide if you want to stay with what you've got or if you want to make a change either to a Medicare Advantage or a Part D prescription plan. Now, the second bullet point, I also want to talk about what is old is now new. We're going back to the Medicare Advantage open enrollment period. We had this actually prior to 2011, I think it was. With the Medicare Advantage open enrollment period, if you have a Medicare Advantage plan and you want to make a change, you will be able to do so between January 1st and March 31st. And the way that enrollment period works is if you're in a Medicare Advantage plan and you want to change to another Medicare Advantage plan, you'll be able to do so during this period. If you're in a Medicare Advantage plan and you want to switch back to Original Medicare and pick up a Part D drug plan, you're going to be able to do that during this period as well. And then you could pick up a supplement plan at that time if you wanted to do so. So you're going to have 3 months at the beginning of the year if you want to make a change to your Medicare Advantage plans. There are a few other special enrollment periods that occur through the year, but basically for most folks, the decision that they make at the end of the year to start January 1st, that's probably going to be the plan that they stay with through the rest of the year. But you will have the opportunity to make changes if you have certain life-changing events. The most important one, or the biggest one that people think of, is if you move. You certainly would qualify for a special enrollment period if you moved from your home here, and let's say you moved to Connecticut. You would have a whole new host of plans to choose from, so that move would qualify you for a special enrollment period. So there are some other reasons you might qualify for a special enrollment period. For example, if you get help paying for your prescriptions from the federal government, what we call the low-income subsidy, that would qualify you for a special enrollment period as well if you needed to make a change to your Medicare Advantage or your prescription drug plan. The other special enrollment period that I want to make sure I talk about is the 5-star special enrollment period. Medicare ranks each of the Medicare Advantage and the Part D prescription plans based upon a host of quality issues. and they will rate each of the plans on a 5-star basis, with 1 being the lowest rating and 5 being the highest. And for the 5-star plans, considered the highest quality plans, you actually can move into a 5-star Medicare Advantage or a 5-star prescription drug plan at any time during the year. You have the opportunity to use that special election period once during the year. So if you find you run into a problem with your coverage during the year and you don't qualify for any other special enrollment period, if you were to meet with a Shine counselor, one of the things that we would say is, well, we can always take a look at the 5-star plans and see if you can use that special enrollment period to change plans. Here in Massachusetts, we're quite fortunate. We have a 5-star Medicare Advantage plan and a 5-star prescription drug plan. For the Medicare Advantage, our 5-star plan is Tufts Medicare Preferred. And on the prescription drug plan side of things, Blue Cross Blue Shield PDP is a 5-star plan. So not everybody has that opportunity. In some states, they don't have plans who have achieved a 5-star rating, so we're actually quite fortunate that we can take advantage on both the Medicare Advantage and the prescription drug plan side of things. So also on this slide, I also included some other dates. If you're a federal employee, or if you know anybody who's getting insurance through the Health Connector, I've also included the dates that they can make changes to their coverage as well. So whereas those two things may not apply to you, you have that information if you want to share it with somebody else. So let's go on to the next page. Slide number 3 at the top of the page. I've given you all of the Medicare cost sharing numbers for 2019. So with the Part A inpatient deductible, remember I told you if you have original Medicare and you go into the hospital in 2018, the Part A deductible is $1,340. That is going to go up next year to $1,364. So there'll be a slight increase in that deductible. We talked about the Part B standard monthly premium. This year it's $134. In 2019, it's going to go up to $135.50. The Part B annual deductible in 2018, it's $183. For next year, it's going to go up to $185. I've also included some information about some of the thresholds that you may cover with your Part D prescription coverage. With Medicare Part D, depending upon the plan that you have and how it works, you may get into 4 levels of coverage through the year. You start off in the deductible phase, if your plan has a deductible, and next year that deductible can be as high as $415. What a lot of plans do is they'll say, yes, there's a deductible for this plan, but it only applies to brand name drugs. With the generic drugs, those don't apply to the deductible. You're going to start paying co-pays on the generic drugs right away. You don't need to worry about meeting the deductible for the generic drugs. That's how a lot of plans work. But you want to take a look with whatever plan you choose to understand what the deductible is for that plan and how that it works. So again, the Part D deductible for next year, $415. Through the course of the year, your prescription drug plan is going to be tracking 2 numbers. Every time you go to the pharmacy and pick up a prescription, you're going to pay whatever your cost sharing is. Your Part D drug plan is also going to be contributing. And so what we're tracking on one side of the equation is, what is the full cost of the drug? What are you paying? What is the plan paying? And they count up that amount of money. And if you get to the point where you reach the initial coverage limit next year of $3,820, you would move into a further level of coverage called the coverage gap. So before I do that, let me actually take a step back. The first stage is the deductible coverage. The second stage is called the initial coverage stage, where typically you pay a co-payment for your prescriptions and the plan pays the remainder. So as I said, right from the very beginning of the year, they're going to be tracking what's the full cost of the drug, what you and the plan are paying. And if you get to the point where you get to $3,820 next year, you would then get into the third level of coverage, which is called the coverage gap, or you may have also heard it referred to as the donut hole. So back in 2006, when we started with Part D coverage, what used to happen is when you reach the coverage gap or the donut hole, you would go back to paying 100% out of pocket for your drugs. Things have changed significantly since we started in 2006, and for most plans, there is some coverage during the coverage gap. And then when the Affordable Care Act was introduced several years ago, there actually is a provision in that which has been closing the coverage gap. So the goal was to close it by 2020. However, because of another law that was enacted this year, the coverage gap is actually closed for 2019. So what that means is, for many people, when you transition from the initial coverage stage into the coverage gap, for some people you're not going to notice a difference. Things are going to be very similar to the way that they are, because in the initial coverage stage, the second level, and the coverage gap, for most people you're going to be paying roughly about 25% of the cost of the drug, and either the drug manufacturer or your prescription drug plan is going to be picking up the rest. So for a lot of people, you're not going to be noticing as much of a difference when you transition from the initial coverage stage into the coverage gap. Now, the other piece of information that we're tracking is we're tracking your out-of-pocket expenses, just what's coming out of your pocket. And I also mentioned that if you get to the coverage gap, the drug manufacturer is actually contributing something, and we're adding up that as well. If you get to the point where you reach $5,100 in what you've paid out of pocket and what the drug manufacturer has also contributed to your drugs, you would get to the fourth stage of coverage, which is called catastrophic coverage, where you'd pay a smaller copay, $3.40 for generic or multi-source drugs, $8.50 for brand name drugs, or a 5% coinsurance, whichever is greater. So if you reach the coverage gap stage, you would be paying that lesser amount, and the plan would be picking up the rest. Okay? So that gives you kind of a general sense of how the Part D prescription plans work. I will tell you that the majority of folks don't get to the coverage gap, and definitely most people do not get to the catastrophic stage. However, if you do, there is help for you. There are 2 programs that are available to folks in Massachusetts. Based upon your income, you may qualify for extra help from the federal government. If you qualify for extra help based upon your income and your assets, the feds can actually help to pay for your prescriptions. If you don't qualify for extra help, if you're over income or you're over assets, we have a program here in Massachusetts called Prescription Advantage. And Prescription Advantage actually has a higher income threshold. Many people qualify for Prescription Advantage here in Massachusetts. And Prescription Advantage is a great program which will help you if you reach the coverage gap. And it will also cap the amount that you will pay out of pocket over the course of the year for your prescriptions. So if you have very expensive drugs and you qualify for Prescription Advantage, it is a great program which could save you a considerable amount of money. So I just want to make sure folks are aware of Prescription Advantage, because it may perhaps be the most underutilized program that there is out there that can be a big benefit to folks. So I want to make sure you know about that. Okay, so at the bottom of the page, continuing on, I want to talk about a new preventive service for next year. So under Medicare Part B, there are almost 24 preventive services that are covered. And to get more information, you want to go to the Medicare and You, and you want to go to Section 3, which talks about what's covered under Medicare Part B. And when you're looking in the book, you're going to see that some of the services have a blue apple next to them. That blue apple designates that this particular benefit is a preventive benefit under Medicare Part B. And we have a new preventive benefit for next year. It's a program for folks who have been identified as pre-diabetic by their physicians. So the Medicare Diabetes Prevention Program is a curriculum that your doctor can work through with you to hopefully prevent you from moving from pre-diabetic to a diabetes diagnosis. So if that's something that might apply to you, this is something you're going to be wanting to talk about with your doctor. And again, Medicare and You will explain a little bit more about how this program works. Okay, let's go on to the next page, slides 5 and 6. At the top of the page, I've given you, again, just a recap of the Medicare supplement or Medigap plan information. As you remember, in Massachusetts, we've got two types. We've got the core and the supplement one. The core plan premiums next year range from $98.42 to $163.45. All of the core plans operate in the same way, regardless of which insurance company you go with. Remember, with the core plan, you're still responsible for the Part A and Part B deductibles, but the core plan will pick up the 20% coinsurance. So personally, in my opinion, why would anybody pick anything but the lowest premium plan to get the same benefits? So in my opinion, I would always lean toward the lowest premium because, again, you're going to get the same benefits from any company that you go with. So that's my personal preference. With the Supplement 1 plans, the premiums next year are going to range from $197.74 per month to $260.51. And the same holds true. Again, in my opinion, I would go with the lowest premium plan because you're going to get the same benefits and services from whichever core plan or Supplement 1 plan you choose to go with. And for next year, actually, Blue Cross Blue Shield of Massachusetts is offering the lowest premium core and Supplement 1 plans. So if you are shopping for Medicare supplement plans, at the bottom of the page, I've given you a list of the companies that are offering them next year. You've got several insurance companies that you can take a look at. And if you want information on any of these plans, you can just contact them directly, and they'd be more than happy to talk you through how the Medicare supplement plans work. So you would contact them directly for more information, and you would also contact them to enroll. Going on to the next page, the Medicare Part D prescription drug plans. You're going to have 26 options to choose from next year, which is overwhelming to a lot of people. I just saw some eye rolls over here. It's a tricky thing when you're trying to determine what is the best Part D plan for you. The good news is there is help available, which I'm going to talk about here at the end of this slide. The premiums for the Part D plans range from $14 a month up to $127.90. And when you're taking a look at the Part D plans, if you have extra help, that's the program that I talked about from the feds. If you qualify based upon your income and your assets and the feds are helping to pay for your prescriptions, there are actually 7 plans that there would actually be no monthly premium because the feds would actually help to pay your premium and it would bring it back down to 0. Extra help will actually give you assistance paying for your monthly premium. The deductible, if there is a deductible with your Part D plan, they'll help you to pay the co-pays, and they're going to cap what you pay out of pocket for the year if you qualify for extra help. So as I mentioned before, there is a tool available to help you determine what is the best prescription drug plan for you. And that tool is called the Medicare Plan Finder. If you go on the internet, just go to Google and type in Medicare Plan Finder. It will bring up, it's on the Medicare.gov website. And what you can do is you can enter your specific drug plan information, because I can guarantee you, if Marilyn and I sat down with each of you individually, I bet I would come up with a different answer for each of you about what the best drug plan is. So you really need to be looking at what your needs are, what your drugs are, to determine what the best plan is for you. The Medicare Plan Finder will take the information that you provide from the drugs that you take. It will give you an estimate of what your costs will be, and I will tell you from my experience, the estimates are really right on the money. I was very impressed with how close it was when I took a look at my father-in-law's spending. I really feel like the Medicare Plan Finder does a really good job of estimating what your costs are going to be. You need to keep in mind, however, that it's just based upon the information that you have now. So when you put in the drugs that you're taking now, you may get a new drug at some point in 2019 that you hadn't anticipated. We can throw that into the Plan Finder too to see if whatever plan you're on is still the best option for you. So Medicare Plan Finder, it's a great tool. And what we can do is, I have sheets up here. The SHINE program can take your drug information. If you're not comfortable using the internet, we can help you by putting your information into the Medicare Plan Finder and getting the results back to you to show you what the 3 lowest cost options are. So if you're interested in us helping you with your Part D plan, just come up at the end. I'll make sure you get a sheet, and we can do that. Or again, if you want to make an appointment with Marilyn here through the Senior Center, she can help you as well. Okay. Just a couple of points next year here in slide number 8. Because of the opioid crisis, Medicare has made some changes in policy for next year, and I just want to go through them. For folks who are getting new prescriptions for pain, they're going to limit opioid prescriptions to a 7-day supply next year. We don't want a lot of these drugs hanging around in people's homes, so they're going to be limiting the supply to a 7-day supply. We also just wanted to point out to you that depending upon the dosage of some opioid prescriptions, your pharmacist may need to have a consultation with your physician. So there'll need to be a phone call, etc. So there may be a delay in picking up the prescription. So Medicare wanted to just highlight that, just so you know if you're waiting for a prescription. Normally, at least for me, I know when I go to my doctor, if I have a prescription I have to pick up, generally I could drive from the doctor's office to the pharmacy and it's ready to go. In this particular case, that may not be the case. And also, all of the Part D drug plans have staff, pharmacy staff, who are going to be looking at opioid prescriptions, again, just in an effort to try to resolve some of the issues that we have out there. Going on to the next page, slides 9 and 10, there are some plan changes for next year. If you currently have First Health Part D or a Symphonics Part D prescription drug plan, both of those plans are going to be discontinued in 2019. So if you're in First Health Part D, you're going to automatically be crosswalked to an Aetna plan. And if you're in Symphonics, you're automatically going to be crosswalked to an AARP plan. So for those of you who might have First Health or Symphonics, if you need help determining if these plans are right for you or if you want to look at another plan, we can help you with a Medicare Plan Finder. At the bottom of the page, Medicare Advantage plans. I've talked a lot about the information that's here, but just to recap, remember, if you're going with the Medicare Advantage plans, one of the first things that I want you to do is determine, is this plan contracted with your doctors? That's what I tell everybody that I talk to about Medicare Advantage plans. You want to make sure that your doctor's contracted before you sign up, especially for an HMO. That is a great way to narrow your options down. Remember I said you've got 6 companies that you can choose from for Medicare Advantage plans. So in order to help you narrow down your options, you want to find out which of the plans contract with your doctors. That's the first thing that you want to do. When you're comparing the plans, you want to take a look at the monthly premiums. You want to take a look at what the co-pays are for your services. You want to take a look if there are any deductibles for any of the services. You want to take a look at the maximum out-of-pocket and the extra benefits. So let's talk about the maximum out-of-pocket first. With Medicare Advantage plans, there is what we call the MOOP, the maximum out-of-pocket, and this relates to your medical benefits, not your prescription, just medical. With the maximum out-of-pocket, the Medicare Advantage plan is keeping track of all of the co-pays that are coming out of your pocket for each of your services. And if you get to a point, if you've had a really catastrophic year where you've used a lot of services, you've had a lot of co-pays, if you reach the maximum out-of-pocket at that point, the plan would be responsible 100%. You wouldn't be responsible for anything else once you hit the maximum out-of-pocket. So with the HMO plans, the maximum out-of-pocket for next year ranges between $3,400 and $6,700. If you go with a PPO plan, where you have the option to go in-network or out-of-network, the maximum out-of-pocket may be as high as $10,000. But that maximum out-of-pocket really gives people some peace of mind of knowing if I have a really, really bad year, I know I'm going to pay no more than this amount in co-pays. So if you had a lot of hospitalizations, that would give you some, like I said, peace of mind in knowing this is the maximum you'd pay. Whereas there is not a maximum out-of-pocket with original Medicare. The other thing that I want to talk about is the extra benefits. Some people are surprised to find out that Medicare does not cover everything. Some of the big things that you hear about an awful lot is Medicare does not cover routine eye care. Medicare does also not cover routine dental, hearing aids. These are benefits that you may get from a Medicare Advantage plan that you would not get with original Medicare. So if you're interested in a Medicare Advantage plan, you want to take a look at those extra benefits because that may be something that's important to you and it may influence which Medicare Advantage plan you go with. A fitness benefit, either a gym membership or reimbursement for fitness activities, that's also a popular extra benefit that you'll see with a lot of Medicare Advantage plans. I just want to make sure that I'm clear. If you go with a Medicare Advantage plan, you do not sign up with a Medicare Advantage plan for your medical benefits and then pick a separate Part D prescription drug plan. That's not how it works. If you're going to go with a Medicare Advantage plan, you get your medical and your prescription benefits from the same plan. There are some Medicare Advantage plans that offer just medical benefits only. You don't take a medical-only Medicare Advantage plan and pick up a separate Part D plan. You get them both from the same company. If you select a prescription drug plan and you're on a Medicare Advantage plan, it will actually disenroll you from the Medicare Advantage plan and vice versa. Okay, and I did mention, as I said before, that the prescription costs do not count towards the out-of-pocket maximums. When we talked about the out-of-pocket maximums, that just applies to the medical benefits. Okay, so let's go on to the next page. So what I have done is I've taken a look at each of the companies that are offering Medicare Advantage plans, and I've just developed a quick summary for you for each of them. As I said, there are 6 of them that are offering plans for next year, and what I've done for each of them is I've listed whether they're offering HMOs and or PPOs, and I've given you the range of the monthly premiums for the plans. I've let you know if the plans are medical plus prescription or if they're offering plans with only medical or medical plus prescription. And then I've also listed the maximum out-of-pockets ranges for the plans that the company is offering. So they're in alphabetical order, so we're starting here with Aetna. So just to give you an example, for next year, Aetna is offering 3 plans, 1 HMO and 2 PPOs. The monthly premiums for the plans range from $0 to $57 a month. All 3 plans that Aetna is offering are medical plus prescription together. The maximum out-of-pockets for their HMO plan is $6,700 for the year, and it's also $6,700 for the year for their PPOs as well. Okay? So each of the insurance companies, I've set them up all the same way, so we can just fly through the rest of them. Blue Cross Blue Shield of Massachusetts, they're offering 7 plans for next year, 4 HMOs, 3 PPOs. The premiums range from $0 to $292 a month. All of the Blue Cross plans offer medical plus prescription, and the maximum out-of-pockets range from $3,400 up to $9,900. That's for a plan that offers both in-network and out-of-network services. Going on to the next page, slide number 10. Fallon Senior Plan is offering 6 HMO plans in Worcester County. Fallon is offering plans both with and without prescription services. So if you're looking at a Fallon plan, just make sure that you realize that they do have a couple of plans that they're offering without prescriptions. That may not be a good option for you if you're looking for Part D coverage. The maximum out-of-pocket for the Fallon plans for next year range from $3,400 to $6,700. Harvard Pilgrim is offering 3 HMOs next year with premiums of $0 to $190 a month. All of their plans include medical and prescriptions, and the maximum out-of-pockets for their plans range from $3,400 to $6,700. Going on to the next page, looking at Tufts. Tufts is offering 7 HMOs next year with premiums ranging from $0 to $185. Tufts is also offering some plans with and without prescription coverage. And the medical out-of-pocket maximums for Tufts for next year range from $3,400 to $6,000. United is offering Medicare Advantage plans. They're marketing under the AARP name, and they're offering 3 HMOs and 1 PPO, and their premiums range from $0 to $76. All of the plans that they're offering include medical plus prescription benefits together. And the out-of-pocket maximums for the United plans range from $3,900 up to a PPO that has a $10,000 out-of-pocket maximum if you're using services both in and out of network. So that just gives you a summary of each of the insurance companies that are offering Medicare Advantage plans. Like I said, if you're trying to decide, if you do want to go with a Medicare Advantage plan, if you're trying to decide what works best for you, the first thing that you want to do is to contact your providers and ask them very specifically, which Medicare Advantage plans do you take? Do not call your doctor and say, what insurance do you take? Because they're going to name every insurance company under the sun. And they might tell you that we take, this particular insurance company, but they don't take that particular insurance company's Medicare plan. So when you call up your providers, ask very specifically, which Medicare Advantage plans do you take? And then what you can do is you can start crossing some of these companies off the list. Because if you want to stay with your doctor, you're probably not going to want to sign up for a plan that doesn't contract with your doctors. So that's the first step that I would recommend in trying to determine what the best insurance company, what the best plan would be. Once you've narrowed it down, there are a few different things you can do to get more information. You can go to the websites for the insurance companies. If you go to the internet and you look up any of the insurance companies, generally across the top of the page you're going to see a little tab that says Medicare. Click on that, go to their Medicare page, and you can find information about all of the Medicare Advantage plans that they're offering. So using the internet can be one way to go. The other thing you can do is you can give the company a call and you can talk to somebody. I'm sure somebody would be more than happy to walk you through what they're offering for next year, explain their various plans. If you ask, they would also be more than happy to mail you out their information about their plans for next year. So you can give them a call and they'll mail you information that you can review and take a look at what they're offering and determine what the best plan is for you. The other thing that you can do is a lot of these companies offer sales presentations. They'll have an insurance broker do a presentation. They'll walk through each of the plans that they're offering, and that's a really good way for you to get some more information and decide if that's a plan that you want to enroll in. So that's another option as well. So just remember, keep in mind that you have until December 7th to sign up for a plan, and then that new coverage will take effect on January 1st. Just to kind of close things out, I want to talk a little bit about the SHINE program and about what we do. At the SHINE program, we're all volunteers. We work typically within the senior centers in the area. We're happy to sit down and discuss your Medicare options. We're more than happy to kind of give you an overview of Medicare like we did this morning. We're also able to assist you in taking a look at your options. As I said, we're more than happy to do a drug plan search using the Medicare Plan Finder to help determine what the lowest cost options for you would be for next year. We often explain mass health programs to folks here in Massachusetts. Depending upon your income or your circumstances, you may qualify for programs under Mass Health, which is Medicaid here in Massachusetts, and we can help you to determine what your eligibility might be. We can provide you with an application. We can kind of give you some sense of what you need to do if you're looking to go in that direction. We're also happy to provide information about the plans or the programs to help you pay for your prescriptions. Remember, we talked about extra help through the feds, and we talked about Prescription Advantage here in Massachusetts. We're happy to talk about that. And just kind of as a reminder, if you want to make an appointment one-on-one with your SHINE counselor, you can just set up an appointment right here through the Senior Center. So are there any questions over anything that we've covered or anything that we haven't covered? You're not being shy because this is being taped, are you? I don't think I've ever gone through a presentation without a question. Okay, so again, if you have more questions, I'm going to be here. I'd be more than happy to speak with you. Marilyn is here as well. And if you have any questions, actually our phone number, again, it's right on the front of the presentation. I also have some brochures for the SHINE program over here. Help yourself. And if you do want us to do a Medicare Plan Finder search for you, I've got forms here as well. So thank you very much, everyone, for your time. I really appreciate it, and good luck with you as you look at your decisions for next year. Thanks.